Assalamu alaikum wa rahmatullahi wa barakatuh. I want to talk a little bit about sihr, jinn possession, and drug abuse. Drug abuse, continuous use, or usage in the past can lead to mental illnesses. It can also lead to mental illness later on in life, even if during that time of use or a few years after using, the person was not experiencing any kind of mental illness. Stress can also lead to mental illness or worsening of the symptoms because of the drug abuse that somebody was using beforehand. Psychological stress, so for example, the way that somebody views the world and the interactions with people, and stress, social stress, for example, stress in close relationships, divorce, or family, etc., can also lead to mental illness. These are all factors that can lead to mental illnesses that some people might mistake for sihr or might mistake for jinn possession. The most likely psychological illness that can be confused with sihr or jinn possession, but sometimes can actually be jinn possession or sihr, is known as schizophrenia. Schizophrenia is also related to drug abuse. I'm going to talk a little bit about one of the main drugs that is involved in creating some of the symptoms that some people might experience, which are similar to sihr and jinn possession, and that drug is marijuana or cannabis. The symptoms of using marijuana or cannabis include on mental health as well as physical. The mental health symptoms include depression, anxiety, and suicidal thoughts. In high doses, it can also cause the person to have hallucinations. You can also get this from other drugs such as LSD and alcohol abuse as well. This can also happen from the drug cocaine. I'm just going to talk a little bit about cannabis. The use of cannabis is known in research to induce symptoms that are related to schizophrenia. The effects and the symptoms of schizophrenia I'm going to include in another video if you'd like to know more about the illness. Marijuana abuse can also be related to some of the external situations that a person might experience that they can also confuse with sihr. So for example, marijuana abuse has been shown in research to increase likelihood of accidents, absences at school or work, increased likeliness of dropping out of school. So if you're experiencing anything like this, it may not be sihr, it may have been drug abuse if you have known to have taken drugs in the past or are currently doing so. Marijuana can be linked to later on mental illness problems. So for example, research found that in teenagers, it was responsible for later life dysfunction. It can also have a lasting negative impact on the structure and function of your brain, which makes it harder overall in your lifetime to deal with negative, stressful situations. Loads of large-scale studies have shown a link between marijuana and the later development of psychosis. So this just goes to show that it may not be sihr or jinn possession if you've known to have such a record either in your family history, if you're abusing drugs, or if you have done in the past, or if you're experiencing stressful situations at the moment or have done for a number of years. It may not be sihr, and these factors do need to be taken into account. There's also research showing that cocaine is also one of the drugs to cause such symptoms. The cocaine user may experience hallucinations and cocaine-induced psychosis, which resembles paranoid schizophrenia. So again, the person will be really extremely paranoid, they may think that people are after them. It can also cause mania, so the person might be really hyper or behaving extremely bizarre, and it can also increase likelihood of the person to experience psychosis. It also alters the brain and the responsiveness of certain chemicals in the brain, which could also have long-term effects and long-term alterations on your brain structure, which can increase your risk of mental illness later on in life. So it may have been that your brain structure has been altered due to the amount of abuse of one of these drugs or any of these drugs. It can even happen from nicotine and alcohol abuse. And then later on in life you come across a stressful situation, and that would then cause you to experience such hallucinations or delusions or extreme depression and anxiety, and all of these symptoms that they do seem like sihr but they might not be. So if you do feel that you have been going through any of these things, it is important every time, regardless of if you have been using drugs or not, to go to the doctor and explain some of your symptoms. It's really important to do this, especially if some of your symptoms can be explained by other illnesses. So, for example, if I'm experiencing insomnia, depression, anxiety, increased heart rate, sweating, bloating, all of these things, yes, they can be attributed to sihr, but oftentimes these kind of symptoms can come across in all sorts of illnesses, and it would be foolish to rule it out and not go to the doctors and not find out if there's a medical underlying cause for these situations. So the best course of action to take is to underline medical issues, to look at the medical side of things, to consider your past and history, to look at everything holistically, and then see and try to diagnose yourself using the Ruqya audios and listening to the Quran and looking for a reaction tends to be the easiest way to tell, because of the reaction that you get just by listening to the Quran indicates that there may be a jinn that is feeling the recitation, but otherwise you do have to look at it as a whole and not jump to any conclusions straight away. I am going to be including more videos about mental illnesses and how to identify and help you to gain a little bit of understanding about mental illnesses in relation to sihr. Assalamu alaikum wa rahmatullahi wa barakatuhu.